Hi, my name is Brianna. I am a nurse practitioner student at Purdue Global University. Today I'm going to be doing a head, eye, ears, and throat examination. First, let me start off asking you your name and your date of birth.
JS, March 4, 2000.
All right, thank you. So first I'm going to perform hand hygiene. And first we're going to start off with your head and scalp. I'm going to be looking for quantity, distribution, and texture and hair pattern. I'm going to inspect your scalp. I'm looking for any lumps, any bumps, and have you had any changes in your scalp or anything you would like to report?
No.
All right, sounds good. And so everything is negative with your scalp. Everything looks normal. Now I'm going to look at your skull and the size and the contour. And you're looking for any scars or bruises and stuff, which I don't see any. And when I was feeling around, is there any tenderness, any pain?
No.
Okay, thank you. So everything appears normal. I'm looking at your facial, checking for expressions and sensation. And can you smile for me? Okay, thank you. And I don't see any masses, any lumps or anything. Facial is symmetrical. Now I'm going to move on to your skin. I'm looking for color, pigmentation, any thickness of hair distribution or any lesions, and that is normal. Your color is appropriate to race. Move on to the ear exam. So I'm looking at your ears for any lumps or any bumps, any skin lesions. And now when I tug on your ear, is there any pain?
No.
All right. What about over here?
No.
And I don't see any abnormalities, any lesions or lumps or bumps over there. Look inside your ear. I see a little bit, I see a little bit of earwax in there, but everything else looks good. I'm gonna look on the other side. The membrane looked nice and gray with no swelling, and I'm gonna check the other side. Sorry let me know if I cause any pain when I'm looking, okay?
Okay.
Yep, it looks good too. All right. And now we're gonna do a hearing test. So I'm gonna have you cover the left side of your ear. All right, and I'm gonna do like a whisper test, and you repeat what you hear, okay?
ABC.
Cover this ear. 1, 2, 3.
1, 2, 3.
All right, and then we're gonna go on the other side one more time. Sorry. Cover your left side.
EFG.
Perfect.
5, NU552M2.
All right, everything is perfect. We're gonna move to your nose. I see no abnormalities with your nose. Everything is nice and structured, symmetrical. I'm gonna touch your nose. Let me know if there's any pain.
No.
And then I'm gonna have you hold one of your nostrils down and start with your left. Take a deep breath in and out. Any pigment?
No.
Okay, and do the other side for me. Deep breath in. Okay. All right. Any pigment?
No.
All right. Any issues with allergies this time of the year?
No.
All right. Perfect. All right. Just gonna look inside. I'm gonna change this one out. Have you lean your head back for me? Looks good. Look, then I already palpated around the sinuses and he said it was no swelling, no tenderness. Everything is fine there. Now we're gonna move on to the eyes. I will be assessing your eyes. So I'm looking at your eyes, if it's symmetrical, which they are. Looking at your eyebrows, nice and symmetrical as well. Eyelashes are appropriate in the right direction. There's no swelling, no excessive tearing or dryness. Get my sanitizer again. And so I'm going to just pull back your, down your eye, just checking your sclera. Then I'll move on to the cornea and the iris. Cornea, I'm sorry. Okay, nice, normal color. Have you noticed any, like, your eyes being dry or watery lately?
No.
Okay. I'm going to use this as a pen light. So I'm going to have you look, let's see, look towards that back wall. I'm going to shine the light. I don't want you to look into the light, okay?
Mm-hmm.
Just want you to look towards the back. So your pupils were 4 mm with the light. It went down, it dilated. No, constrict, sorry. We'll do the vision test. Turn this off. I'm gonna have you cover your left eye. And can you tell me how many fingers I'm holding up?
2, 3, 1.
Okay. Can you cover your right eye for me?
2, 1, 4.
Okay. And I'm gonna have you follow my finger, okay? Perfect. Now moving on to the mouth and the throat. Your mouth is symmetrical. The color is appropriate for race. Lips are moist, no lumps or cracking. And now I'm going to look in your mouth. I'm going to use a tongue blade just to look at your throat, your tonsils, see if it's any swelling. All right, so I'm going to use the tongue, use it. And can you say "ah" for me? Open your mouth like "ah." Okay, everything looks good. No swelling. Tonsils are intact. Soft palate is normal. I'm gonna look just under your tongue and on the side, make sure your tongue has any lumps or lesions. All right, everything looks perfect there. Thank you so much. Moving on to your neck. Everything looks asymmetrical. Feel around for any lumps, any masses. So it is a lump over here on the right. Can you explain that to me, please?
I think it's a lymph node that I was born with, but it said it's non-cancerous, so I should just ignore it.
Okay, and then you told me that you got testing on it, and they said there's nothing cancerous. Okay, and then let me film the other side. All right. Any tenderness when I felt?
No.
Okay. And trachea. No lumps on there. Any tenderness?
No.
Okay. Everything is midline. Trachea is midline. Here's normal. No deviation on each side. And one more thing, and then we'll be done. I'll have you just do a shoulder shrug. Thank you. Everything's normal, no pain. All right. So the assessment turned out within normal limits. Thank you so much for allowing me to do my assessment on you. If you have any questions, any concerns, all right. Thank you.